Thank you. Mr. Alford, you're recognized, sir.
Well, thank you, Chairman Diaz-Bayart and Ranking Member Frankel for holding this. I think this is a very important subcommittee hearing that we're having today. Thank you for being here. PEPFAR has saved the lives of millions of innocent people and strengthened global health for decades now. Dr. Dybul, I'd like to thank you for your work in establishing this program during the Bush administration. Your work has saved millions of lives. But as we are doing today, we are confronting the fact that this last administration has somewhat turned this life-saving program into something it should not be. Using taxpayer dollars to fund abortion is abhorrent. I know the number is 21. It would be abhorrent if we used taxpayer dollars just for one single abortion. And I know you've spelled out how this happened with the nurses in Mozambique and the money that was returned that was supposedly used for this, I want to focus on how we prevent that from happening again. So, Ambassador, first off, does the use of taxpayer funds for abortions, what does that do to the public trust in this program?
Certainly for a lot of Americans that would undermine the trust in the program, and that's something that needs to be rebuilt. And there's no question about the need to rebuild that. And any violation of any law of the United States is something the American people should be concerned about.
If we move forward with funding for PEPFAR, what guarantees can you make that American taxpayer dollars will never be spent in this program again for another abortion?
It's hard for me to guarantee that because I'm no longer in the administration. However, what can be done, as often happens with other violations of law, are a couple of the things that I mentioned. One is the training, so that everyone is aware of what the law is, which unfortunately these nurses were not. Secondly is to require them to actually sign attestations that they are aware of that. And third is to do regular reviews, which is the most powerful thing you can do. But you need people and money for that. So there are a few countries, not many, but there are a few countries that have legalized abortion where PEPFAR operates. That's where you really need to do your focus on those pieces, and you need to go out to the field and you need to do program reviews. And you need to do them regularly, but you also need to do them randomly, because that will make people aware that if they're caught, there's going to be a penalty and a cost. So those are the tools that can be and must be used to ensure that this does not happen again.
Let's talk about the transition plan. Ms. Connors, are you in agreement that this should have a transition to private entities, faith-based organizations in other countries?
I think we view this as a really strong opportunity to start the sustainability and transition process. I think that Ambassador Dybul and I may disagree on the pace of that. Obviously we work at the project level. We have a lot of experience with transitioning projects to local ownership, to governments over time. On average, it takes us a 4 to 5 year period of time to really walk through, identify what we're going to transition, how we're going to transition.
I have 2 minutes left. So you're in agreement it should be transition. It's just a time difference that you have with the ambassador.
And the planning process. The well-planned part of it is very important.
Ambassador, what is your time frame for a transition?
It's difficult for me to have a time frame again because I'm not operating, but I do work very closely with many African leaders. They want to work to transition as quickly as possible. And I do think
5 years, 10 years?
Some countries we can start the reductions now. It's not as if you do fund completely and then you just transition. It's a constant reduction.
What guarantee do you have that if we transition out, that China won't transition in, filling in the void that we leave behind?
Well, the thing is, if you do the transitions right, there is no void left for them to fill, because you would transition to local organizations, government, non-government, faith, community-based organizations doing the work. And we've seen this happen. We know it can happen. We already have 60% of domestic resources going to fund the programs. The issue is timing and planning, and it's going to be country specific. So there are some countries that have relatively large resources. For example, I've talked with the people in South Africa. They could transition probably in a year or less, but they need to know where to put the money. There are other countries in similar position. There are Nigeria, Tanzania, Kenya, Namibia, Botswana, countries that actually have decent incomes, but they would, The risk is that if we go too quickly, that void will be there. If we plan with them, bring in the private sector to invest as well, it's a gain for all of us. There will be no void, and we will be the heroes. We will have successful transition versus failed transition. It's the failed transitions that will lead to that void and opportunity.
Thank you. I yield back.